The robotic project is all about providing high quality evidence-based rehabilitation for those who have upper limb impairment as a consequence of neurological illness or injury. The core purpose of the project is about providing a model of care and to be able to bring the best services to people locally in a rural area. The idea came about from input from our clinicians about what is the thing that we need to do for the people that we serve. And robotics, interactive gamification of rehabilitation were things that came up as being prime areas of development.
This project's really important to NHW and the local community because our vision is to be leaders in healthcare, and we're actually the first regional hospital, public hospital in Australia to offer this state-of-the-art technology. The local community have actually invested their funds to enable us to purchase the robotics. So being able to do this project and make sure the model of care that we're providing is important in demonstrating our trust to the community as well. The regional area often means that for patients to get that specialty intervention, they might have to travel outside of their local area, and that can be a cost to the patient, but also that burden of emotionally having to travel outside of what's familiar to them.
Robotics technology works by allowing patients to practice repetitive motor tasks while playing fun and engaging and motivating computer-based games. Our service currently has 6 different robotic devices, and these activities and games can all be graded depending on the level of motor control which your patient has. And all these games provide feedback and encouragement to the patient throughout their therapy. Staff really love the program as they're able to deliver consistent, high intensity, engaging therapy. It's really changed the way we deliver upper limb therapy to our clients, and early outcome measures have been very positive, and we really look forward to seeing the final results.
Back in February I had a stroke which affected all my right hand side. I didn't have any movement or strength or anything in my right leg or my right arm. I think it's really helped with my motivation, and it's just been fantastic because I'm just getting so much out of it.
To see Kay from when she had the stroke to now, the improvement in her right side has been phenomenal. Yeah, she's worked pretty hard at it all, and yeah, it's helped her enormously. Yeah.
I had a stroke, brain stem stroke. Of course, I got pneumonia, and I couldn't walk, can't talk, swallow. Here's all that life was like a rag doll. Well, I played the robotics, and they have several games on different things, and I use also my hands and talk, so it's social. I've got stronger in my arms. I haven't been assessed yet, but I think it's helped me.
I think, well, we're the only one up in the northeast, as far as I know, and the next closest is Melbourne. I just wouldn't be able to afford to go up and down to Melbourne to get the equipment.
We've had lots of health services contact us around how they could and which robotic devices could be used, and part of the project was really to be able to provide them with informed information. What we can say at this point is that robotic therapy provides intensive and engaging upper limb therapy. We would suggest that rural and regional health services aim high, that it is actually possible to implement a robotic model of care into health services.
Well, there's been many factors that have been essential to the success of this project. The support of the community to enable us to purchase the robotics in the first place. It's also given us some great opportunities to connect with other experts in the field around robotics and this type of intervention. Executive support, they've been behind this project and this concept for many years, And Benefit Care Victoria, we're just really grateful for the commitment they've had to us. They've really seen the value of the community's engagement and the commitment from the organisation to be able to provide this to a regional area.
Our next step will be to embed the robotics program into our community setting. Our aim is to have this as our usual care of upper limb therapy for people who are experiencing upper limb impairment.